Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Today, about 1.2 million people live with HIV in the United States. Once considered a death sentence, HIV can now be a manageable illness. However, disparities facing many communities who live with this virus make this hard to achieve. Dr. Oni Blackstock, HIV physician and founder of Health Justice, joins us for a discussion on inequalities within this sector of public health. Doctor, thank you so much for joining us.
Thanks so much for having me on.
So let's just jump right into it. I've noticed that sometimes HIV and AIDS are used interchangeably, but what is HIV and how does that differ from AIDS?
Right. So HIV stands for human immunodeficiency virus. So it's actually the virus that weakens the immune system. So the system within us that fights infections. So HIV targets the immune system and then leads people to get infections that they wouldn't ordinarily have, or cancers or other conditions. And so when HIV, the virus, weakens the immune system so much, usually when the level of T cells, which are one of the cells that fight infection, when those get below a certain number, we then will say that someone has AIDS, which stands for acquired immunodeficiency syndrome. And so that's when the virus, HIV, weakens the immune system so much that the body can't really protect itself against different infections and cancers.
So there are so many disparities in regards to HIV. However, an alarming disparity arises when it comes to contracting the virus. Despite prevention efforts, some groups of people are disproportionately affected by HIV. As a physician, what are some social determinants you see are linked to this disparity?
Right. So I think just like many other conditions, medical conditions, we see social determinants of health, and in particular, structural factors such as racism, sexism, homophobia, and transphobia, really impacting people's ability to access care, to go to appointments, to have insurance, to be employed. All of these things play a role in people being able to take care of their health. And so when we have these factors like racism, sexism, transphobia, those act as barriers to really people being able to take care of themselves, seek care, and that often places people at increased risk for HIV, or if they have HIV, can make it really difficult for them to be able to engage in care.
So, according to the CDC, in 2018, Black Americans accounted for 42% of new HIV diagnoses. For Latinos, it's 29%. We kind of talked about it briefly just now, but how does race impact how likely you are to be diagnosed with this virus?
Right. So I think we can choose. So there are a number of ways in which race or racism plays a role. But if we look at, for instance, health insurance. So health insurance is a major way that people are able to access health care for instance, for HIV testing so that they know their status, to be able to access HIV treatment, or to be able to access a pill called PrEP, which is a once a day pill that can be taken daily to prevent HIV. And so we know that in this country, for a number of reasons, because of occupational segregation that tends to concentrate Black and Latino people in jobs where they do not have benefits, such as health insurance, that then places them at an increased risk for being unable to access care if they need it, testing, prevention, or treatment. So that's one sort of pathway that places Black and Latino people at increased risk for either acquiring HIV, like not knowing their status, and then potentially spreading it to other individuals within their community. Because if someone doesn't know their status, then they can't always take measures to protect others.
Now, I think this is very shocking. The women in these communities are uniquely vulnerable. As the CDC reports, for African American, 92% of new HIV diagnoses were attributed to heterosexual contact, and it's 87% for Latino women. However, men in these same categories are seeing much, much lower numbers. How do we begin to address this disparity when we look within our own communities?
Yeah, so when we see Black and Latina women be impacted, and just to say for your audience, this is both for cisgender women, so women who people who identify as women and who are also assigned female sex at birth, as well as transgender women. So those are women who may have been assigned male sex at birth, but identify currently as women. So Black and Latina, cis and trans women are at increased risk for HIV. And this is because of the intersection of racism, sexism, and also transphobia. So for instance, Black and Latina women may be at increased risk because, for instance, if mass incarceration, for instance, is targeting Black and Latino men, that takes a number of eligible partners out of the community. And so women may be more likely to have a partner who has other partners. And so when people are in relationships with people who are also in other relationships, that can also drive risk of HIV as well as sexually transmitted infections.
Wow, so it's kind of like just so many layers that goes into this. So thank you for explaining that because I was really shocked by that. Now it's been decades since the start of what we known as the AIDS HIV epidemic, and you've mentioned in a Time article, given current trends, we're on track to end the epidemic among white Americans much sooner than we are among Black and Latino Americans. Can you elaborate on, why you said that?
Yeah, so it's really interesting. For instance, if you look at HIV data from New York City, for instance, you will see over time that an increasing proportion or fraction of new diagnoses are actually among Black and Latino people. So 80 to 90% of diagnoses in New York City are among Black and Latino people. This was not the case at the beginning of the HIV AIDS epidemic. There were inequities, but those have just gotten significantly more profound. And so there have been some studies done, we call them modeling studies, where they use math and different formulas to figure out, when will we see the end of the epidemic for different populations? And they looked at a number of different major cities in the United States and found that for Black and Latino Americans, it will take 10, 20, perhaps more years to end the epidemic among those groups than among white Americans.
So, upon my research, I also found that African Americans have low viral suppression rates. Can you just first explain what that is for some of us who don't know?
Sure. So the way that HIV treatment works and the reason why it helps to maintain people's health and prolong their life is because by taking it every day, it helps to suppress the virus or keep the virus at very low levels so it cannot copy or replicate itself. And so we sort of see one marker potentially of the success of HIV treatment is seeing when a patient is taking their medications that their viral load or the amount of virus they have in their blood is pushed to very, very low levels. And that can have positive impact for the individual, as well as if someone has an undetectable viral load where it cannot be detected by a test or a viral assay. What then happens, that person is actually at no risk of passing HIV on to their partners. However, we see that there are disparities or inequities across groups with Black people and also Latino people having lower rates of viral suppression when they are taking their medications or when they have access to medication. And again, this is driven by some of the same barriers that I previously mentioned.
Now, what are some overall prevention challenges that, people in these groups are having?
Right. So what's really interesting is that when we look at the data, Black and Latino men, for instance, men who have sex with men, for instance, are a very highly impacted group. However, they are actually less likely to have risk behaviors, sexual behaviors, and drug use behaviors that we associate with HIV risk. The reason why Black and Latino men who have sex with men are at elevated risk is, again, because a number of factors that I mentioned earlier, including the fact that when people socialize and find partners, sexual partners, they tend to do so within their own communities. And so because of poverty, because of segregation has concentrated Black and Latino people in certain communities, and because of these other factors, such as lack of access to care, have led to people not knowing their status. For instance, Black and Latino men who have sex with men are at increased risk of HIV, even if they engage in what they think are protective behaviors, such as just having one partner. And so really the challenges are around, ensuring that people have access to HIV testing, that they have access to the PrEP pill that I mentioned the once-a-day pill to prevent HIV. But the challenges are if someone doesn't have access to a clinic, if they don't have health insurance, or they don't have a healthcare provider, that can make it more challenging for them to get access to testing and get access to the PrEP pill.
So the epidemic started, several decades ago, and it's been 3 decades since Magic Johnson revealed his HIV status to the world. And over the years, he's contributed to the education of this virus. Despite that, when we take a closer look, do you believe that the stigmas attached to HIV still heavily affect urban communities? And is there still a lack of overall education?
Mhm. Yeah, so that's a great question. And I think it's, really inspiring for many people to see Magic Johnson, who, when he was diagnosed, came out, became an advocate around HIV. He talks about it less so now, but he's obviously lived a very long life, and he appears quite healthy. And it just shows sort of the impact and the power of HIV medications, or if someone has access to those. Um, Nevertheless, we still see that HIV stigma remains an incredibly powerful barrier to testing, to people getting connected with HIV prevention as well as HIV treatment. We know that, for instance, Billy Porter from the show Pose, he only recently disclosed his HIV status, even though he's someone who's in the arts, where we know there are many people who, are living with HIV, and often they feel safe to share their status. He was playing a character who was living with HIV, and even still, he felt so stigmatized that he did not want to share his status. So HIV stigma remains a huge barrier that needs to be overcome in order to end the epidemic.
Doctor, thank you so much for joining us. Can you just tell us quickly, how can people stay in touch with you and learn more about the work that you're doing?
Sure. Thanks so much for having me. So you can follow me on Twitter at Oni_Blackstock, or also you can check out my website site, healthjustice.co. Thanks so much for having me on.
Thank you for joining us. We'll be right back with more Open BXRX Tuesday.